Thank you, Archdeacon. Good morning, brothers and sisters. You may be wondering what this bag is all about, right? This presentation, I intend it to be very interactive. I don't want to. So the presentation is on diabetes, and really Archdeacon asked me to speak about the lifestyle management of diabetes. But I thought that to give some context, I would just talk about diabetes for just a few minutes and then go into the lifestyle management. Hence, I have all of these things here which I may ask you to show persons. Portion size things, plate, it's Sunday, books to give away, Archdeacon, a little guideline. That sounds like the presentation, right? Anyway, so when we talk about diabetes, I'm sure that if nobody here is diabetic, you may know somebody who is diabetic. I'm a family physician, and I see so many persons who are, should I use the word suffering to an extent, or persons who have been afflicted by diabetes. So I will start by establishing that there's a direct connection between diabetes and food. A fact that many diabetics have come to learn very quickly. The fact is that food is at the cornerstone of everything that we do. In fact, when someone is diagnosed as a diabetic, the first thing they ask me is, what are you going to eat? So sometimes you'll find that persons come in, they're diabetic and they don't know exactly what diabetes is. So what happens is that in a well-functioning body, a signal is sent, a signal is given that the glucose has entered the bloodstream. And so what this glucose is supposed to do is into the bloodstream, and then it is supposed to go from the bloodstream into the blood cells to do the work of the body. So the glucose is in the intestines. I'm being very simple here. Doctors in the audience, forgive me if I'm too simple, but we have to be. So we eat the food. The glucose we're looking at now is going to go from the intestines into the bloodstream, and then from the bloodstreams into the cells to do the work of the body. So to do all of that, what happens is that there's a hormone which is called insulin, and insulin is produced by the pancreas, which is a little organ right behind the abdomen, right here where I'm showing. So that organ, the pancreas, produces insulin, and the purpose of the insulin is to move the glucose from the bloodstream into the cells to do the work of the body. Now, in persons who are diabetic, something is going on wrong with that whole process. So we can see now if something is wrong with that insulin, which is, we can look at it like a bus, which is supposed to transport people from point A to point B. So if something is wrong with the insulin, we can see that the sugar, the glucose, is going to back up in the bloodstream. And basically, that is what diabetes is. That is really what it is. And it is the high concentrations of glucose which would be found in the bloodstream, which can give rise to numerous complications. So anybody wants to tell me a complication of diabetes that you know about? One possible complication? Problem with the eyes? So you can start from the top. Every single cell, by the way, can be affected by the high sugar level. So we're looking at the eyes, can give rise to something called diabetic retinopathy, using some big words there. Can give problems with the heart, have heart disease. Can give problems with the kidney, give kidney disease. It can affect the intestines, That is something we see happening with diabetics, and it can also affect the nerves. We're talking specifically now about, to be very simple, nerves which will be in what we call the periphery, the feet. And we know that if there is a problem with that, it can give rise to amputation. But before people get amputation, most of my patients will complain about this. Boy, doctor, I have this pain down into my foot them. That's what person said, my foot and my foot bottom. That is the sugar destroying the nerves and causing a problem there, and so on and so forth. With the statistics in Jamaica, it says that 1 in 8 persons is diabetic. So that is about 12.5% of our population. To be honest with you, it is actually higher than that. That is in my estimation, because this would be those persons who would have been caught into the surveys that have been done. Diabetes is also known as a silent killer, because in most cases the early symptoms of the disease do not show up. So persons can actually have the disease and not know that they are diabetic. Diabetes, we know, is one of the leading causes of death worldwide. In Jamaica also, it is about, forgive me if I don't know the exact statistics, it is not the second leading cause of death, it's about the 4th leading cause of death in Jamaica. And we know when we talk about death, death is one thing, but we're talking about illness and so on. It is really a problem. Now, how many types of diabetes are there? That is a giveaway, Archdeacon. How many types of? Yes? Whoa! Yes, so how many? You have to tell me the types. And the third one is? I do this in class all the time. I give my students the answer. Of course. What that mean? Yes. Oh, wonderful. So this is a copy of my book on diabetes. So there are three types of diabetes. Type 1, which affects about 5% of the population or less. And then type 1, all right, and then there's type 2, which affects about 95% of the population. Type 2 is known as non-insulin dependent diabetes. And then, as my friend here says, she reminded me, gestational diabetes, which affects women who are pregnant. So those are the 3 types of diabetes. No, there are different causes of diabetes. I want to just link this to what Archdeacon has spoken about earlier. So the causes of diabetes, we know aging is one, obesity, being overweight, is another one. Prior history, let us say, ladies who have gestational diabetes got pregnant when they got diabetes when they were pregnant, and then it goes away when they deliver. Those ladies are now at risk for the development of diabetes afterwards. So that is one. There is something called pre-diabetes. You know, there's a pre-something. So you can, I tell my patients, the people will say they have a touch of it. I don't know about this touch thing, but this is it's like you don't satisfy the criteria for the diabetes, but you're on your way. It's right there, but it's there. So that is pre-diabetes, something that people don't talk about. It's also known as impaired glucose tolerance. There's physical activity, inactivity, that can give rise, as we say, or contribute to the development of diabetes. Your race is another one, and in certain families, diabetes run. Guess what, in keeping with what Archdeacon has said earlier, spoken to us about in his presentation, in the interest of time, I have seen this happening, stress. So stress and intense, unrelenting stress can cause or contribute to the development of diabetes. This was illustrated to me very, very clearly a few years ago when a new patient came to me and I was taking a history and he says he's diabetic. So I said to him, so how long have you been diabetic? He said, since my 16-year-old daughter was murdered. So I'm just showing you what can actually cause this or contribute to this. Now, there are different tests for diabetes, your random blood sugar. We can talk about this and so on. Your fasting blood sugar. There's another test which, if anybody is diabetic or knows of anybody who's diabetic, you may be hearing about glycosylated HB, hemoglobin. You hear that one? HbA1c? Yes. And that one is the one that is going to let us know how well controlled the sugar levels have been in the 3-month period leading up to the test. So some people, always ask them to check the blood sugar levels in them, and they will say, boy, doctor, man, I check my sugar level in the morning, and every morning it is okay. Okay is not a figure, by the way. It is okay. And I will check it sometime in the day, and it's also okay. So I said, well, let us check, when you go to the lab, and when we look at that now, that is what is going to let us know how well controlled the sugar levels have been. So in the interest of time now, many of you may be saying to yourself now, if I am diabetic or if I know anybody who is diabetic, what can be done in terms of the goals of treatment of diabetes? We know we need to keep the glucose levels within normal range. We have to do as much as possible to prevent what we call short-term and long-term complications of the disease. And we cannot forget that we need to improve the quality of life of the patient. So the recommendations, there are a number of recommendations. Exercise is going to be important. So we know that based on what the Ministry of Health and Wellness says, what research has said is that we need to be exercising at least 30 minutes, 5 times per week. But for some people, that is a problem, to be honest with you. So I tell them if you can do 10 minutes in the morning, 10 minutes at lunchtime, 10 minutes in the evening. So you could say walk 5 minutes from here, then 5 minutes back. That's what, 10 minutes? And you do that 3 times for the day. You have to learn how to make it work for you. The next thing now is going to be what to eat. So it's not mango season, so we can talk. So in terms of your meat, this is kind of far. So in terms of what to eat, was designed by Miss Andrea Hunt, who is a diabetes educator. So you'll see a plate there. In terms of persons who are diabetic, what we do with the plate, and see I have my plate here, half of the plate should be vegetable. Yes, and I know you're going to say vegetable expensive. Yes, I know. And then this part here will be your carbohydrates. We're going to talk about what a carbohydrate is. So this little part here, about half of the quarter of the plate, and then the rest can be protein. So if you're making up your plate, if you look on that diagram there, you see that there was a chicken leg and what you call leg and thigh, right? So that is okay for you. So you eat about 3 to 4 ounces of chicken. And you say, but how much is that? You mean you have to weigh? Not necessarily. 3 ounces of meat is going to be about the size of a deck of cards. Yeah, that's about 3 ounces there. Well, it is. It's Sunday, so people want to eat rice and peas, right? So how much you think is your portion size for rice and peas? How much is your portion size for rice and peas? Yeah, you said what? Somebody said half of a cup. So half, it doesn't mean half of my teacup or your teacup. It means this, if you're baking and they say half a cup of flour, that's a half a cup. So in terms of rice, this is about it. Half a cup. And now in terms of vegetable, the plate must be, half of the plate is vegetable. So the plate in terms of portion of vegetable could be half a cup of cooked vegetable or say 1 cup of raw vegetable. So you see, you're not starving. No, you're not starving. And then you could have a fruit. You eat in season, so it doesn't appear that you're spending all your money on food, which it appears when you go to the supermarket anyhow. But if it's apple, you could say, have a eat out apple. And what do you think you should drink? Lucozade? Water is good. We know that people may want to say, have something sweet, but this is where reading portion sizes is going to be important. So you look on the labeling to guide you as to portion sizes. Have I reached 15 minutes yet? I'm okay? So I want to keep into my time. So that is really what I wanted to say about diabetes, because I know persons may have questions to ask. Any questions, any comments? What about soft drinks?
I have a question up here.
Upstairs.
Hi, hello, hi.
What about people who are taking medication to control diabetes and thereby, because of the strength of the medication, tend to have low blood sugar rather than high? How should such a person eat?
Okay, so that is where it's very important to monitor your sugar levels and to know what a normal blood sugar level is. So a normal, say, fasting blood sugar, when you go for your blood test, and they say you have to be fasted, that is the lowest blood sugar level, that should not be more than 6.1 millimoles per liter. It's going to say that on your glucometer. By the way, every diabetic needs to have a glucometer at home, and they actually need to know to use it, because some people are afraid to stick them finger. Okay? I'm being practical here. So that is 6.1. And you also need to know 2 hours after your heaviest meal, it should be more than 7.8 millimoles per liter. With that said now, if you are taking medication and you find that your blood sugar is too low, you need to have a chat with your healthcare provider to see if they can what we call de-prescribe. So in other words, if you need less medication, that is one thing. In case you say you're taking medication and your blood sugar level goes down too low, you need to know what to do. So one of the things that you need to know to do, it would be to have a piece of hard candy with you. They have some ginger sweeties that you can buy at the pharmacy. I'm just giving you an example of that. You could, for example, take about 6 ounces of fruit juice, and there are a number of recommendations like that. Have I answered your question?
Mostly, but I was just wondering, what about frequency of meals and that sort of thing?
Well, the thing with the frequency of meals is that persons who are diabetic need or ought to, that's the correct term, to be eating frequent small meals. Frequent small meals, and this is very individual. So you need to know your body. You need to know your particular numbers. Know that, okay, the doctor can say, I must only eat half a cup of my rice and peas. But I know that based on my activity levels, If I eat 1 cup of rice and peas and I check my sugar levels 2 hours after that, it's normal. Or when I go to the doctor and the doctor is checking my glycosylated hemoglobin, people call it HbA1c level, it's normal. It means that you are individualizing your particular care. Because half a cup of rice and peas, I couldn't say that to a construction worker to go eat half a cup of rice and peas, then laugh after me, okay? So you need to be able to individualize things. This you will realize is a very short presentation, and a number of the details that we could go into, we would need to go into another time. But I want to ask you, you know the bottles of soft drinks like this? About how many teaspoons of sugar in one? Dr. Melbourne Chambers can't answer. You can't answer. Okay. How many teaspoons of sugar? Nobody? 17. When to read
17?
Yes, sir. That is why you should really have a segment on reading food labels, you know. The bottles like this, yeah, it's about that. Because when you look on the back and you look on carbohydrates, look on the amount of carbohydrate, divide it by 4, and you will see the amount that is in the entire bottle. And you mustn't drink the whole bottle at once. That bottle is for 2.5 people. So me, Archdeacon, and we give our server here. So, had a question?
A comment, Doctor. On top of all that you have said, apportioning, Jamaicans love gravy.
Yes.
Everything has to be soaking in gravy. There is a commercial right now on mackerel, and it's like a soup. There's so much gravy and sauce. So I'm sure that has contributed a lot to the present situation.
Yes, if you want to have gravy and salad dressing, I have the container for it. Portion. One of the most important things that we can do for our bodies is to be mindful of our portion. I am not diabetic, but I actually am mindful of my portions, what I eat from long time. Just be mindful of your portions. So that is it. That is I hear the comment, but that is the key thing there.
Thank you, Dr. Campbell. I kept thinking about the elderly and be mindful in within the context in which you're.
I'm not hearing it properly. Just pull the mask down.
I'm saying I listened keenly and I was mindful of the elderly in talking about diabetes. And I would not have left church today without reminding us that today is being celebrated as the International Day of Older Persons, 60 years and over. And I was really thinking about the older persons with regards to diabetes, and especially those older persons live alone and what we need to do to help them.
Well, one of the things that is such a thorny issue, because I've seen so many persons, let us think in their 80s, for example, their 90s, who live alone. And by living alone, some persons don't know what it is that they must eat, or for convenience, what they do is that they eat what we would call nutrient poor and calorie rich food. So that will be predominantly, let us say, rice, a whole heap of rice, and maybe a whole heap of gravy on top of that, and maybe a little bit of protein and no vegetable at all. Some people may eat a little piece of fruit if they can afford it. So what can be done if you know somebody in that particular situation is to say, guide them as to what they can eat or ought to eat, or provide them with a meal, even let us say on a Sunday afternoon, to help them out. But it is a serious issue because I have a significant number of patients, elderly people who absolutely live alone. And they're in that situation, they don't take their medications, nothing like that. So you're going to see that the quality of life for these persons is not a good quality of life at all. Any other comments? I have one more giveaway, Archdeacon. Let us ask. In the meantime,
Dr. Campbell, just asking for reinforcement. What is the number? What is the normal number for a fasting blood sugar? That's number one. And then the 2 hours after meal, what that number should be.
so they should be 6.1 on the glucometer, 6.1 millimoles per liter or less than that for fasting blood sugar. So when you just get up in the morning, don't eat anything or so on, it should be that. So you use 6.1 as a marker. It should be less than that. 2 hours after the heaviest meal. Let's just say your heaviest meal is lunch, and you eat lunch 1 o'clock, and you take your time and you finish 1:15. 2 hours, so that would mean 3:15. When you check your blood sugar, it should not be more than 7.8 millimoles per liter. That is what is on our machines. The Americans have another measurement, so their measurement, you have to multiply that by 18 to get their measurement. But most of the machines in Jamaica would be in the millimoles per liter. That is the one. That is the one. That's okay? I have another giveaway. What is the portion? What is the portion size for cooked vegetable? Oh Lord, so many people, one person come up and the person who's going to stand up and be confidently correct or confidently incorrect. For the portion size for cooked vegetable, I want for cooked vegetable. Cooked vegetable. So sit there, and so what is the portion size for raw vegetables? Wonderful. Wonderful. And one last, nobody from this side, Archdeacon, but I'm to this side. I don't know. What is the portion size for cooked rice and peas? Yes, good.
Okay, thank you, Dr. Campbell.
You're most
Thank you very
welcome.
much. Very interesting. Now,